Hi everybody, it's Dr. Lisa with you again from Healthy Fit Physical Therapy and Wellness Consultant. I'm here to give you guys 3 fit tips today regarding a muscle that is, or a group of muscles that are rather ignored in my opinion as a therapist. We're going to be talking about the TMJ, which is short for temporal mandibular joint, which is essentially the muscles that make up the jaw joint in itself, okay? So frequently patients will contact me for pain in that area. Some people don't even realize that it's an issue that a physical therapist can address, but it is. And so you will sometimes have people complaining about pain here along their jaws or up here, sort of in their temporalis area, and headaches, a very, very common sign of TMJ dysfunction. And so I just want to give people 3 tips to sort of help alleviate that. I do want to start this off with a small disclaimer. The TMJ complex is very complex, and so you definitely need to speak with your doctor, in some cases your dentist, your physical therapist, about the origin of the pain, because it can be coming from several contributing sources. So if you are able to perform a few stretches and monitor your activity and it gets better, great. If not, definitely speak with your doctor to see about some other alternatives. But just really quick, 3 tips. The first thing, when you're talking about the temporal mandibular joint, or the TMJ, it's composed of muscle here, which is called your temporalis, by your temples, and then muscles that go down here into the jaw. And there are several of them. I won't get into all of the anatomy. But what you want to do to make sure that you're not upsetting those muscles every day and having them on fire, because essentially that's what TMJ pain is. Those muscles are spasming and they're upset. One, you need to make sure you're not a teeth grinder. I'm going to have my model here give you an example of what teeth grinding looks like. So when you clench down on those back teeth and it gets those muscles here jutting out and really hard, that's something you want to avoid. During the day, it's something you can be mindful of. Some people, if they get upset or stressed, they might do that. So you want to avoid that. If it's something that you're doing at night, then that's a whole different story. You might need to look into getting some type of a night guard to stop that, because you're not really in control. The second thing I always suggest to my clients is to avoid chewing gum. Some of us are heavily addicted to gum. I love gum, but I have suffered from some TMJ pain, so I try to avoid it as well. But essentially, think of chewing gum to your TMJ muscles as lifting a weight on your bicep. If you're doing this for an hour a day or longer, eventually that muscle is going to be completely fatigued, completely worn out, possibly spasming and causing some pain. So I suggest that if you've ever had any severe jaw pain, avoid chewing gum. And the last thing I suggest for people is just to do a really gentle massage at the end of your day. You may already be doing this, but at the end of your day, just take your middle fingers and just do some gentle rubbing along those muscles. So we'll start here at the temporalis muscle, and then work your way down to the muscles into the jaw, and you can follow them right along the jawline. Sometimes actually inside the cheek, some of those muscles are also responsible for some of that pain and tension, okay? So if you feel that you have frequent headaches, you have a lot of jaw pain, start to do a little bit of gentle massage every day. Avoid grinding your teeth as much as you can. See about getting a night guard if it's something that you're doing at night, and then also definitely avoid chewing gum. And hopefully you'll have less headaches and less tension in the TMJ area, okay? So thanks for tuning in, and come back for more fit tips soon. Thank you.